Holford Health Centre, how can I help you?
Well, I press on there and that's sore.
Yeah, that's very sore.
Okay.
Yeah.
Is it all right if I have a look at your chest?
You're so good.
No.
It's fed up with just being in pain all the time. It's just getting to the point where it's just... I'm so sorry.
That's all right.
I would say that means there are some issues with your memory. I mean, it'd be quite good to have a chat with your wife sometime.
She reckons it's close to dementia. Still there on the end, red. I tried Germany. Jesus, what? Not a good idea.
Good morning, Holford Health Centre, Sally speaking.
Morning.
Morning.
Come on in. How are you doing?
Arm. I don't know what's going on. It's been like it since the beginning of March. I thought
Okay.
maybe I'd sort of muscle thing or
Yeah.
anything, but I can only sort of move it so far.
We can certainly have a look at that.
Right, okay.
Okay.
Okay, going up is fine. The side, and it goes
Yeah.
that far.
And
then
whereabouts
it's-
exactly is it painful?
it's
Just
like-
in the main...
Yeah, it's like, can't really pinpoint it, to
Is
be
it in
honest
the
with you.
elbow? Is it sore in here?
No,
And it's not sore when you move your forearm, it's sore when you move the top bit?
no,
That's okay?
yeah.
Pull me in.
So I can feel something there.
Okay, and does it hurt as you go up the back, like doing your bra strap and stuff?
Yeah,
If you push me up here, does that hurt?
that does.
Okay, so that's the thing, that's the movement that brings it on.
is, yeah.
Just relax now. If I move it, is it less bad than when you move it?
Yeah, it's less bad.
It's less bad?
It's less bad.
Okay. It's good. So that helps me to figure out what's going on.
Oh, good.
So I think what you've done is injured one of the muscles around the shoulder that comes down into the back here.
Oh.
And it's called your infraspinatus muscle. And the reason I can tell that is because there's one movement that brings it on particularly, and that's pushing up against me here. And that is the muscle that's used to do that action and to move your arm around. The other thing that is making me sure that it's that is that when I move it, you're not having to use any of the muscles, obviously.
no.
And so, but it shows that there's nothing in the shoulder joint that's causing the problem. I think probably that this will just settle down
Right,
with
okay.
some time.
Yeah.
And I think that probably we're going to get away without needing to do any physio if it's not causing you too many problems. I would suggest that you try some ibuprofen 3 times a day, for maybe up to a month, would help to settle that down. And then I'll see you again, and if it's still bad at that point,
Okay.
we'll get you some physio for it.
All right, okay.
Does that sound
Yeah,
like a reasonable
sounds
plan?
good.
So yeah, try that plan and just keep gently exercising. One of the things that you can do for your own physio is to put your arm out here and write the alphabet. So,
really?
okay, so you start off small, A, B, and if you just do small letters first,
Okay.
C, D, and then later on in the week, do it a bit bigger, A, and then by, a couple of weeks' time, you can do really big letters.
Okay.
And then if you do the alphabet twice a day, morning and night, but just getting bigger and bigger letters, by the end, you'll be doing huge ones.
Right, okay.
And that's quite a good way of just
Yeah.
getting some of the physio done for your shoulder.
Right,
So
then, I will
do your
do
own
that.
exercises
I will
with the ibuprofen,
Do my own.
and then
yes.
we'll see you in a month's time if it's
Right,
not settling
okay.
down.
Good.
So, hi, and what's your name?
Susie.
Susie. Hi, Susie. How can I help?
Past few days, she seems has like sort of flash heart and then red cheek, and she has sort of like a cold sore in the mouth.
So this started how many days ago?
It's about 3 days.
Yeah? Has she been eating and drinking normally?
She's drinking,
but
she's not really
eating.
eating.
She's not eating much. So, Catherine, how are you feeling?
When I just washed my face, it's too hard. It just hurts.
What does it hurt, lovely?
The little...
Hurts the little thing on your lip. OK. Outside of this being sore, is there anything else, owie, or hurting at all? Anything else sore?
My throat.
Your throat's a bit sore. Let's have a little look at you, if I can, darling, and we'll have a little look and see. Because I'll just put little gloves on, not because of you, because of my hands. OK, lovely, let me have a little look. Open wide like that for me and give me a really big ah.
She's
Tongue right down for me, darling. I'm going to have to just tick up the back there, darling. Sorry, love. Her tonsils look pussy again. I'm going to just lie... Can I lie you down, darling? Because I'm just going to make sure that I've got some swabs, because I'm going to take 2 swabs. One viral swab for the little ulcer, because that looks virally, but her tonsils look really white. You know, like they've got pus on them. What I'm going to need to do then is I'm going to have a little look at the back of that throat and then open wide. Right, it's a bit bright on that, so that's it. Perfect. So you close your eyes for me, Catherine. You're being ever such a very grown-up girl here. That's it. And open wide, wide, wide for me. Give me an R. Say R for me, love. Say R, R, R.
Ow.
Sorry, darling. What I'm going to do is I'm going to just now take a little tickle at the back, so it won't be like my finger. So if we just do the same again, it's just like a little cotton bud. So if you just open wide for me, darling, you're being ever such a brave girl.
Yeah.
That's all done. Sorry, darling. I'm so sorry, Poppet. It's really mean. I'm so sorry. You're ever such a brave bunny. That's it. Good girl. I think she's got a bacterial tonsillitis again. And her breath is smelly, isn't it? I think you're a very brave girl. We'll send those off. So I think the throat is the problem. Yeah. And I think the ulcer could be related to it, but not caused by it, in a way. OK, we're going to give you some medicine, all right? And it's really important to take the full course. It's tedious because it's 4 times a day and for 10 days, OK? So I would make an appointment to bring her back to see Jane Gosh in about a week to 10 days. I will send both those swabs off, though, OK? So definitely get that tonight with the chemist. Yes. And lots to drink, OK, lovely? Make sure you're drinking lots of water like you're being a really good girl. You are very brave. I hope you just feel better soon.
Thank you very much.
Thank you, Susie. Thank you. Thank you. Bye, Annie. Bye.
Hey, do come in. You all right?
No, not really.
What do we need to discuss?
It's my memory.
OK.
I had a row like with the missus last night over some stupid thing. And 20 minutes later, I didn't know what the row was about. And she asked me to put something by. I put it by. Then she asked me then a couple hours later, well, that thing I gave her, where did you put it? I can't remember where I put it. You know, it's things like that.
Is this something that's come on fairly recently, do you think? Or
no,
has it been going on for a while?
I've been going, for a while, like. I mean, I told her...
I think I've had a previous letter from the hospital where someone said they were a little bit concerned about your memory.
I told a specialist, and as you know, I've just seen her. And she said... your memory loss and what you call is probably due to depression, whereas you worry about your mother's death, you worry about your memory, you know. Well, I do get depressed.
So I think there was some concern about your memory before your mother's death, wasn't there? Actually?
Yeah.
Have we done a memory test with you at all?
What was that?
Just a test to try and assess actually how bad your memory is. Have we done a check at any stage?
No, I haven't. I can't remember it.
Can't remember one. I was about to say that, but you said it for me. OK, should we do that today?
Yeah, that's fine.
OK, and then we'll chat about where we go next. So I'm going to give you a name and an address to remember. OK.
Right.
The
not
name,
too long, though.
Not too long. John Brown, and he lives in 42 East Street, Bedminster.
42 East Street, Bedminster.
OK, give me the whole name.
John Brown.
Yeah.
42 East Street, Bedminster.
Super. OK, I'm going to ask you that again in a minute. All right?
Right.
Romaniac, please. OK, all right, you've been in the wars? Yeah. All right.
Good pronunciation.
Oh, was it? OK, yeah, good, good. All right, good. That's good. Right, so you were in yesterday.
Yeah, I was in yesterday.
With toe problem.
Yeah.
And the doctor suggested you go and get it x-rayed. Have you had it x-rayed?
I went and they were really busy, and the bloke looked at me and had a look at it quick, and he said, oh, just go and have a look at the x-ray you had 2 months ago. And he said, yeah, I can't see anything. You're going to have to go back to your doctors.
OK, let me have a little look then, just to try and see what's going on. It was 2 months ago.
Yeah.
You were playing American football, fell over, landed on your big toe. But you had an X-ray at the time, and you were told, OK, still unable to run or put weight through toe. Is a PE teacher, so affecting work, obviously. Dr. McLaren examined you yesterday. He thought it all looked normal, and he suggested re-X-ray to confirm no missed fracture. OK. Let's have a look.
Yeah.
OK, all right, which foot are we talking about? Your right foot?
one, yeah.
OK, all right then. OK, if you want to hop up there and have a look. So this is now, we've just agreed, it is 6 weeks, yeah? That's just important because a soft tissue injury, my pat line is 4 to 6 weeks.
Yeah,
and you're not quite at that yet.
OK.
OK? Now, I don't know if you've been resting it.
I have, yeah.
OK, so whereabouts now is the pain?
If I press in here, it's like excruciating, right underneath there.
OK. I'm not pressing hard enough, or is that...
It's like where you had it there, like underneath.
Just under here, yeah. So it's a little bit warm, it's a little bit swollen. OK. So how long did you take anti-inflammatories for?
Probably the first couple of days.
OK. Right, well, I agree with you, it's a little bit warm, and it's a little bit red, and it's obviously still sore. So you get your things back on, and let's have a think about what we're going to do. OK. OK. Right, so you put your...
It's just one of these things, because sports is my life, and, like, I'm sitting at home feeling like I'm getting fat, I'm getting, like, depressed over it, and I can't, like...
OK. First thing, is that, 4 to 6 weeks, you're not quite at that yet, OK? So what I would do now is take anti-inflammatories and then book in to see Dr. McLaren in a routine appointment for maybe 10 days, 2 weeks' time.
OK.
See if it's improving.
OK.
And then we can take it from there. OK?
No problem.
Is that all right?
Yeah.
Sorry. I'm sure you get through.
Right.
I'm sure you'll get there.
Yeah.
OK? Don't run before you can walk, literally.
Oh, yeah.
OK?
Thank you so much.
OK, all right then. I hope it settles down soon.
Yeah,
All right,
thank
bye-bye.
you. Bye-bye.
What was that name and address I asked you to remember?
Brown.
What's his first name?
Brown. E Street. I can't remember.
I can't remember his first name. Do you remember what his address in East Street was?
No.
No? OK. And do you know where East Street is?
That's Bedminster,
Bedminster, that's right. You're very good, yeah. OK. Now, without looking at the watch or clock or anything, can you tell me what the date is today?
No. 10th.
10th of what?
Of June.
OK.
Yeah.
And the year?
2017.
OK. OK. All right. Now, a little drawing exercise here now. This is a circle. OK.
Yeah.
I'd like you to imagine that that is a clock face. Can you put the numbers around the clock face for me? OK. Now, if the time was 10 to 2, where would the hands be? Could you draw the hands in on your clock?
10 to 2. 10 to 2.
Okay. OK. That's the end of the memory test. There were some gaps in your memory. I mean, obviously you struggled a bit with the fellow's name at the end, John Brown.
John, that's it.
Yeah.
Yeah.
And you did struggle a bit with the clock, actually. But
12?
Well, no, but not putting the numbers around the dial. I don't know if you...
Oh, right round, you mean?
Yeah.
That's why you do it, like that.
Yeah. I would say that means there are some issues with your memory. I mean, it'd be quite good to have a chat with your wife sometime and see how she perceives it.
Well, she reckons it's I'm close to dementia. I just go into dementia. Okay. That's stupid, isn't it?
Okay. But I'll have a chat with her sometime. What we normally do if people have got problems with their memory is there's a set of blood tests that we do, which just occasionally help us to know what's going on. We normally get a scan done of the head as well, CT scan of the head. I don't know if you've had a CT scan for your epilepsy at all, have you?
No. I've got so many tests I can't remember.
And it will also be useful from an epilepsy point of view as well. So we get that scan done, we get the blood test done.
Yeah, I've had a few fits.
Yeah.
Last time
And it'll be useful to meet with your wife next time, actually. Book a double appointment and come with her. All right. You'll get an appointment through the post for a scan.
Thank you.
OK. And when you've had the scan, give it about 10 days and then book an appointment and come with Liz for a double appointment.
Right.
OK?
Yeah, thank you, Doctor.
Jolly good. Okay. Bye-bye. Now, I'm Dr. Jewell. Hello. And this is Mummy, isn't it?
Yeah.
Usually I ask that, but we know that already. What can we do for you?
So I brought her in about 4 weeks ago because she had a really nasty cough, but she was fine in herself. She was running around, so I didn't think it was that big of a deal. But it turned out she had a chest infection. So she had some antibiotics for 5 days, and the cough went away for about 4 days, but then she must have got another virus. So she's been coughing pretty much on and off since then, but I've noticed the last 2 days she's been coughing up some pretty disgusting things again, haven't you? Yeah.
What's she been like in herself?
She's generally quite an ill child, but she does tend to just crack on. So, yeah, she's been running around, she's been going to nursery. We've been on holiday, haven't we, last week?
Where did you go? Do you remember?
Yeah.
Do you remember? Was it
Tenby.
Tenby.
Tenby? Do you know, I've never been to Tenby. Everybody says it's really lovely. OK, let's have a look.
Let the doctor listen to your chest like
Emily,
last time.
is it all right if I have a look at your chest?
You were so good
No.
last time, weren't you? You were
Why,
super
sweetie?
Good.
What's the matter?
Oh, she didn't go.
Sophia, what about if Sophia has hers listened to?
Well, let's do this. We're going to listen to Mummy's chest. Then we're going to listen to Sophia's chest. And then we're going to listen to your chest. Excellent. Very good, girl. Can I have a listen at the back?
Can you see?
There we go.
I can see a bed.
Can see a bed? Do you think the doctor has a lie down?
I have been known to have a doze in the afternoon. To have to make sure somebody wakes me up in time for surgery.
Brilliant.
One last thing, just to feel under your chin. So just...
What do you think's under your chin? Do you think there's...
No, sweetie. Come here.
Sit on my lap.
Sit on Mummy's lap.
You're being so good. Do you remember Mum
Emily.
said if you're super, super good, you might get to have a token when we get home? Yeah? How many tokens have you got at the moment?
I want you to give me your hand. Thank you. Do you want to put your hand on top of that? Do you ever play this game? Now listen, all I want to do is to feel here, sweetie. There, that's lovely. That was all. I'm finished now.
Good girl.
She's fine. I'm not going to give her any antibiotics.
Okay.
Her chest sounds clear. She's not struggling to breathe.
Brilliant.
At all.
Okay.
She looks well.
Yeah.
I think it's interesting that you're worried about her.
Yeah, I think it's because I missed it last time.
Ah, yes. So you feel a bit, you know.
Yeah, bad, and then.
So that's one. So that's a perfectly sensible explanation. That is. So you know, until they're about 12, this is what happens.
Yeah, and this is why I do tend to just leave it. But I think because it got bad last time, I felt a bit.
But while everything else is okay.
Yeah.
While she's not struggling to breathe.
Yeah.
And she's normal temperature.
Yeah.
No, don't worry about it.
Okay, fantastic. There you go. That wasn't too bad, was it? You're going to say thank you?
Thank you.
Oh, good girl.
Emily, it was a pleasure. You were a really, really good patient. I don't know what your mum you were being so good and helpful. And Sophia
has done a fantastic picture.
Time to go home.
Yeah, let's go home. Thank you very much.
Pleasure. Bye-bye.
Yeah, you still got it. Say bye. Say bye-bye. Can I help?
Stand away because I'll trip all over you.
Where did that lot come from? They said it was going to be heavy.
Though.
No, but they said if it's going to be heavy, it'll just...
Yeah, absolutely.
chuck
We'll
it
see how
down.
waterproof it is. Thank you. Can I have Peter, my prescriptions, please?
Yeah.
Have a seat.
I'll sit over there.
Yeah, I'll be all right.
Right, what can I do for you?
Stressed out from work.
Right.
I did ring them this morning, tell them what the problems were, which was a long list I give them. I said I just want time out. So I've also been snappy with my wife as well, coming home. Unbearable. And just shaky as well.
Okay. You're not sleeping either, are you?
No, I was up at 4 o'clock this morning, which was unusual.
So how long's this been for?
A couple of weeks you've been quite
Yeah, 2 weeks, I think.
Right, okay. And what's brought it on, do you think?
Stress at work, plus when I'm going home, I got to care for my wife as well, just getting too much.
He's near to tears, because you can see that, aren't you? Hey, yeah.
Okay. And it's okay if you want to cry? Yeah? Sometimes
Just
it does
let
us
it
good. When you say you've got to care for your wife if you've got medical problems?
Yeah, I've got very bad arthritis in
Right.
my legs, and there's things at home that he has to do for me, and at the moment, you know, stupid things like I can't get to the shop, so we need a loaf of bread. He'll come in and say, oh, we need bread. And the balloon goes up. Okay. At the moment, because he's snapping at me, we haven't got that relationship. We've got a very good relationship that is like, well, what have I done?
Okay.
I'm stuck at home 24/7, you know, and it's like, isn't it? And I mean, we've had our holidays, not as though you need... I mean, we're only, what, just over a month ago we were in Portugal, so it's not as though we It's not like him. Normally, if I say, could you do this for me, he does it, and it makes me feel guilty, because he's stressed.
Yeah.
And it's like...
Okay, okay.
I'm a little bit behind today, hopefully not too long.
God, it's been non-stop today.
Come on, what are they doing?
So I'm running late. It's Dr. Ahmed, OK? About 20 minutes.
Give me 1 second and I might be able to do something for you. Be with you just for a sec.
Oh.
Hi, can I help?
So you're under a lot of pressure, at home. And what's the stress at work?
Well, explain to the doctor what you do.
I'm a driver carer for adults with learning difficulties. I enjoy the job. It's not a problem, but they've been putting me under a lot of pressure, changing what I'm meant to be doing, not informing me, and things like that.
Sometimes things just hit the limit, don't they? So what do you think will help at the moment?
Time out, time away, and just potter about or go out or...
Yeah. Why don't we give you a couple of weeks off work and come back and see me in 2 weeks to see how things are having had time out? Yeah? OK. So there's a sick note for 2 weeks. We can always extend it, so don't think you've got to go back in 2 weeks, OK? Take this to reception to book a follow-up appointment with me, so then I can follow you up in a couple of weeks, all right? OK, things will get better.
Right, OK, thank you.
No problem.
That's it. Thank you.
Have a seat.
Good afternoon.
Good afternoon, I'm Dr. Jewell.
Right, I think I got an ear infection because I can't hear properly this right ear.
You can't hear properly out of it?
No, everything's...
It's not because it's hurting?
It's like being underwater, as such.
You had it before?
No.
OK. How long has that been going on for?
Since first thing Monday morning.
Let's have a look at this here first. Yep, that looks fine. That one looks all right as well, which is a bit of a disappointment. You've got a little bit of wax in there, but nothing that's obscuring it. Now, hold on. Somewhere in here, we have a very old-fashioned piece of medical equipment. Have you ever seen these things before?
Yeah.
OK, can you hear that?
Yes.
If I put it there, can you hear it?
Very faintly.
Is it louder there or there?
There.
Good. Louder there?
Yes.
Or there?
Louder there.
Okay. Can you hear it on one side or the other?
Hear it more on the left.
Okay. We're going to do a very crude test. I'm enjoying myself. Now, what I want you to do is to turn and face me, and we're going to do a crude hearing test.
Okay.
I call out numbers. You call them back to me so I know you've heard them properly.
Okay.
Put your left finger in your left ear. 67.
67?
32.
32.
Your hearing's all right. Don't know what makes it.
It's very, very quiet.
Yeah, OK. Other ear, but I think there's no problem about this. 86.
86.
23.
23.
And that was easier to hear?
Yeah.
Yeah.
A lot easier.
Yeah. Now, that's a very crude test, but it's good enough to satisfy me that we don't need to worry about this, but we can afford just to wait and see what happens. You maybe have you had a cold or anything that would explain it?
No.
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 Okay. I think it might be sensible just to wait and see what happens.
Okay.
Give it a few weeks, and then if it's still bad, try out there.
Okay.
All right.
All right. Thank you very much.
Pleasure.
Thank you.
Bye-bye.
I've grown up with that. My dad's like that. He makes tea exactly like David. And, you know, if you go somewhere, he needs it in a teapot, needs the milk separately and hot water separately. So in cafe, you know, in Costa Cafe or whatever, it can be a bit of a problem.
How are you getting on?
Pain.
Pain?
A lot of pain. It's just getting stupid.
And is this the pain that we were talking about before with your tummy, or is it different?
Same.
No, same
Just
pain.
getting more and more intense.
And this has been going on for a long time, hasn't it? Have you heard anything more about the referral that we made to the gynaecologist?
Yeah, I've got a letter through for a choosing book thing.
Oh, good. Because actually that's part of what we need to do, isn't it? From my point of view, I'm wondering about if we can just keep you going until you get to see them. Is that with some painkillers? And then we'll see what they've got to say about what they can do.
It's fed up with just being in pain all the time.
Is there anything else going on that's making things worse?
It's just getting to the point where it's just, like, you just feel like you can't be bothered to do it anymore. You know, I don't get a lot of sleep as it is anyway with my second youngest, because he's insomniac and other things. But it's just, like, the pain on top of it, it just makes, you just get up in the morning and you're just like, I'm so sorry.
That's all right, here's a tissue, look. Why do you think it suddenly got on top of you? Has anything else been happening?
No, it's just getting, like, the pain's just getting more intense, more frequent.
What are you using for the pain at the moment?
I take cocodamol, and then I take 2 tramadol before I go to bed.
That's right, I remember you saying that before.
Amitriptyline.
Yeah. Are you taking any anti-inflammatories?
I can't take amitriptyline.
Why is that? Why?
It makes me bleed even more and gives me
Does
even
it?
worse
So it's
tummy.
actually that settles it, sets it off.
Yeah.
And what about the amitriptyline? What dose are you on of that?
Well, 2 some nights, but I have been putting up to 3, like you said.
Because that's a very reasonable thing to do. Has it made much difference? No. Because it makes that tricky, doesn't it? Because you're basically on the full dose of all the different painkillers that we've got, especially if you then can't take one particular class of them. In terms of medication, the other thing would be to try some more, you know, something stronger on top. But I think I remember you saying that if you tried other stronger opiates, then it just made you feel really sleepy in the day. Was that right?
If I stopped taking the tramadol, it was like I was like a heroin addict or something. Like I was proper like shivering, I felt all fluey and everything.
Maybe then the best thing is for me to write a letter to the gynaecologist asking for them to see you urgently and just pull it forward that way to make sure that it's going to be quick. Because the problem is I don't know, based on how long the referral date will be, whether it is going to be 2 weeks, in which case maybe we can just carry on waiting for it. Or if it's 2 months, then obviously that's too far away, isn't it? Shall I drop them a quick line and just make sure that that's pulled forwards? And I'm going to see you in another week or two just to double check on how things are going, but mainly just to talk again about how you're coping with it all, because it's obviously really difficult for you, isn't it? Have you got any other support? Who else is at home helping you out?
It's just me and the kids.
That sometimes makes it really tough, doesn't it? And of course there's no magic fix for those sorts of things.
Yeah.
Sometimes there are some charities that are available that will give you extra support. The Citizens Advice Bureau can give you advice about where to turn as well when they're looking for these sorts of things, so they may be worth an appointment. Do you know who I mean?
Yeah.
Have a chat with them about whether there's anything else about that, and I'll see you in a couple of weeks, and I'll get on and do that letter for you.
Thank you very much.
All right.
Thank you.
I'll see you soon.
Very good manoeuvring, thank you.
Lot of practice over the years.
Yeah. OK, coming in. And are you a carer or a relative?
Carer.
Yeah.
Carer,
OK. So you think you're having a bit of a flare-up of the MS? Yeah.
Yeah.
And what happens normally when you have a flare-up?
I don't know, it depends. I get different symptoms, but always one leg or both is affected anyway.
OK.
Sometimes my arms.
Yeah. So overnight and this morning, it's the right-hand side that just feels weaker.
Yeah.
Painful.
Really painful.
Right.
I'm actually waiting for HSCT treatment as well.
What's that?
That's the stem cells and chemo.
Oh, right, OK.
So I'm waiting for a phone call. It could be about 4 weeks' time.
How much is that meant to work?
It's got a good chance of stopping progression.
Right, OK.
So if it stops progression, I'm happy enough with that.
Absolutely. That's
we go.
exciting then, isn't it?
It is. It might
So what does
be.
the actual treatment involve?
The first time I have chemotherapy, the first time for a day.
Yeah.
And then the second time I go up, I got to go into isolation for about 3 weeks.
Right.
I have 5 days of high-dose chemo.
Yeah.
The stem cells are taken out with me.
Yeah.
All the MS ones are taken out of that.
Right.
And then they're put back into
Beautifully described that. I bet the doctors told it like that to you. did
Yeah,
they?
yeah.
No, that's easy to understand like that, isn't it?
Yeah, that's putting in.
Yeah.
It's a really big thing because I've got secondary progressive, so I'm only ever going to get worse, but this will stop it dead in its tracks. And I won't have MS anymore. I just don't know if I'm still going to have the symptoms that I've got at the moment.
OK.
MS. It's an autoimmune condition that affects the brain and the spinal cord. This is where the body sort of attacks itself. In this instance, it attacks the surroundings of nerve tissue and affects the messages sent along those nerves. There are two main focuses of treatment with MS. One is to treat flare-ups and relapses. This is often with steroid therapy and individual treatments looking at specific symptoms. The other way of treating it is by using disease-modifying drugs to try and prevent relapses.
Is there anything to see on your arms at all?
No, I said, but I think they're quite
there.
bruised.
Yeah, what's that from?
I don't know.
OK. And squeeze my fingers for me. So there's less power there. Is there always less power there? No, so that's
This
less
is my
than normal.
good size.
Is it? Right, OK. What about your leg? So pull this one in. That's it. That's quite good. And try this one. So pull it out and then try and pull it in. Yeah, it's less there, isn't it?
Yeah.
OK, so I think we need to just speak with the MS nurse, really. How quickly, you said you don't know when she'll get back to you?
No. Sometimes they get back to me within a day or so.
Yeah. Well, look, I'm here all day. You've rung up this morning. If you don't hear anything by 2:30, 3 o'clock, give us a ring here, OK?
Yeah.
And we'll reassess and see if I can try and speak to the consultant if we can't get hold of the nurse.
All right. Okay.
All right.
Okay.
So let's hope the nurse rings you back,
Yeah.
but if she doesn't, give me a shout.
Yeah.
Is that
Okay.
all right?
Yeah, that's fine.
If I don't speak to you, good luck with the stem cell.
Thank you.
Anne-Marie Jeffries, please.
Hi.
Hello there.
Hi.
All right.
I'm okay, thank you.
Good. You have a seat there. All right. What can I do for you today?
It's been for about the last couple of months, but it's been getting worse. I keep getting really bad pain and soreness. Started from the armpit and going just around there.
Okay.
I keep a check on it to see if I can feel any lumps and bumps. I haven't been able to feel anything, but it's just really uncomfortable and painful.
Okay. So 2 months pain in your right armpit coming round onto your right breast.
and then just coming round on the right breast.
All the time, or is it related to your period or anything?
It seems to be pretty consistent.
Okay. And you're well otherwise, are you?
Yeah.
Okay.
Yeah.
Nothing around the other side?
No.
Periods are okay?
Periods are normal.
Not pregnant or breastfeeding?
No, definitely not.
Definitely not. Does it feel like it's your muscles or your ribs, or does it feel like it's inside?
It doesn't feel muscular. It's really weird. It's just like, and I can't really put my arm down like that because it's just like.
So it's certain
really
positions.
Sore. Yeah.
Okay. What about if you cough?
If I cough, it hurts quite a lot more.
Okay. Have you got a cough?
No, not at the moment.
No. All right. We need to have a little look. Okay. Is that okay?
Yeah.
I'll put the curtain over for you. If you want to slip your top things off.
Yeah.
Can I pop round?
Yes.
Okay. All right. And you'll just get your arm up. Okay. Have you got the pain right now?
Yeah, it's like, so it's like from there, yeah, it's like, hurts there quite a bit.
Okay.
Yeah.
So I press on there and that's sore.
Yeah, that's very sore.
And then it comes round a bit further, does it, as
Yeah,
well?
ow. Yeah.
Sorry. Okay. Have you got pain over here?
No.
No, not at all? Okay. Can I just check the breast area? Is that all right?
How are you on this lovely sunny morning?
Oh, raring to go.
Yeah.
So tired.
I know, it's weather.
Yeah.
Sleeping. Would you like a tissue? Because it's quite hot, isn't it?
Thank you.
It's so hot. I think my face is melted.
I get sweat pads in the back.
Are you getting enough to drink? I mean, the weather is very hot at the moment.
So hot.
I know.
It's so nice outside.
I never wish for this heat. We're lying. I like the winter.
Do you?
Yeah. Snugging up on the sofa with cups of tea and hot chocolate. Fire, blanket, I love it.
Nice. That sounds quite nice. But...
And then in the summer, it's just like, I just need my space.
Yeah.
I was like, nah. Are you all right having your blood taken?
Yeah.
Yeah.
I'll be fine.
Okay.
I think. Should be.
Okay, you sure?
No, yeah, I will be.
Yeah.
I give blood. I'll be fine.
All right, then. Which arm do we go for bloods?
I'm right-handed, so maybe I should do my left.
All right, yeah, that's fine. Whatever suits you. I just do what I'm told.
So is it checking everything? So it's just going to check for...
Yeah, you've got a bit of a full MOT going on here.
Good. That's what I need. I'm falling apart.
Oh, really?
Ooh. Yeah, I've got all sorts going on.
Oh, that's not good. Well, hopefully we can get you back up on your feet again.
I know. Hopefully we'll find something out. I know what will happen. It will come back and be like, oh, you're fine, you're healthy. Yeah.
You're like, what's wrong with me then?
Something's wrong with me. I know.
Don't go fainting on me now.
No, I won't. I won't. I'm not really squeamish.
I find all of this quite fascinating
Yeah,
now.
I think I quite like
I do.
sticking needles in people.
When I first started doing the training, I was a bit unsure, and I was thinking, I don't know.
Yeah.
Because you practice on this like kind of like plastic arm.
Oh yeah.
And it's got like veins in that, and then once you go kind of let loose on patients, you're a bit like. I can remember I was doing it on one of my colleagues, and my hand was like that. I was so nervous, but then after a while, it's
quite fun.
Yeah, you just get used to it. Okey-dokes. That's brilliant.
Nice.
That is you all done. So these will be back Monday, and then you can speak to the GP about the results.
I think I'm in like Thursday or something anyway, so I might as well just wait.
Cool.
All
Thank you.
No worries.
Oh.
Have a nice day.
You too. When do you finish?
5:30.
Oh, not too
bad. Thank you.
Take care. Bye-bye.
The breast tissue itself's not so sore. It is what we'd call musculoskeletal.
Okay.
That's fine. Okay, you put your things back on.
Did you take up any new sort of fancy exercise or anything like that just before it started? You been doing anything weird? What's your job?
I clean, so my job's quite vigorous.
Yeah. Okay. Okay, so the good news is I can't see anything
That's
I'm worried
good.
about that, okay? I think that is what we would call musculoskeletal, which means it's like the soft tissues or the ribs around there,
Okay,
It's not the
yeah.
breast that's
Okay,
the problem,
that's
okay?
good.
What I would suggest you do is rather than taking any tablets,
Okay.
you get yourself an ibuprofen gel, which you can go and buy, and it's cheaper to buy. If
Okay.
that's all right, okay?
Yeah.
And just rub that on, and then
Okay.
just start doing some gentle... Do you do much exercise? Are you sort of...
I've started playing netball.
All right, and can you play netball? It's not uncomfortable to play netball?
It's a bit
Quite strenuous,
uncomfortable,
isn't it?
but yeah, not.
Great. Use the gel.
Okay.
Continue with your netball.
Yeah.
That's fine.
Okay.
And wait and see what happens. So
Okay,
hopefully that
cool.
will just settle down.
Okay.
All right?
Okay.
If
Thank
it
you
doesn't,
very much.
I'd like to see you again.
Okay.
Okay?
Thank you
Is that
very
all
much.
right? Okay.
Thank you.
Hi.
Uh-huh.
Hi. Ooh. How are you doing?
Tired. My eyes feel like peels in the snow.
Right. What do you mean by that?
They're tired.
Yeah.
They're sore and but they're just sore.
And you link it to tiredness, though?
Well, I do, yeah.
Yeah, and is that a feeling that you've had all your life when you get tired, that your eyes get like this? Or is
Only
this
since I started having the diabetes.
Right, OK.
Now, knackered.
So the tiredness is linked to having the diabetes. What about the eyes? Is that something is that a feeling that you've had before, or is that something?
Yeah, they just feel sore and tired.
Just not right?
No.
Is your vision OK?
Not all the time, no.
Not all the time?
Bit blurry.
When does it get blurry?
Basically when I lay down on the bed and watch television.
Yeah. And when you blink and try
it clears it.
It does clear it. So it does go back to normal. Let's have a little look at your eyes here. Have you been to the optician?
Not lately.
Just look up. Look down. Look left. No double vision. Look right.
Gritty.
Feels gritty, does it? Yeah.
Not now, but it does.
So I think what's happening is that the eyes are being feeling gritty, and probably I'm going to try some moisturising drops because that's the most likely cause of them feeling a little bit uncomfortable. I want you to go and see the optician as well and just get your eyes checked over. I can't see in the back of your eyes very well, and that needs to be looked at by the optician just to double check that that's OK. And I think a lot of this is down to the diabetes, and that's what we're working on to try and control as well.
Yeah, I know. I should murder that.
I'd like to see you in the next 1 to 2 weeks just to check up on the head. And if you could go to the optician in the meantime. And I've sent the drops over to the chemist.
One other thing, can I have some more ointment for my downstairs because it's not gone. I've been to the hospital twice. They said it's, I don't know, some name, but not anything to worry about. It's still there on the end, red, and I wipe it every time I go to the toilet now.
I'll give you some more.
I tried Germany, Jesus, what? Not a good idea.
Try this one, ongoing.
I thought I'd have a go at Germany, I got enough here. And I wish I hadn't.
So if you take that to the front desk, the cream and the drops have gone to the chemist. All right?
Yeah.
See the optician too about your eyes.
I'm beginning to feel I'm a nuisance.
Well, it's not something that I'm feeling, so, you know.
Well, I'm glad about that, but I get peed off with... I told you I got this, I got that, but I have.
I know. Well, that's, you know, part of the challenge, isn't it, of getting a bit older.
Oh,
I know it's annoying.
That old chestnut. Yeah, unfortunately, you're right.
I'll see you soon.
Yes, hopefully. Cheers.
Bye.